Hey, future nurses. Ready for a deep dive into something super important for you?
I'm ready.
Let's talk skin integrity and wound care. It can feel like a lot, right? But we're going to break it down and make sure you have the know-how to give awesome care to your patients.
It's really fascinating stuff when you get into it.
For this deep dive, we've got some really great sources lined up. We'll be looking at the anatomy of the skin
Yeah.
and all those factors that could make it vulnerable. Plus, we'll get into the amazing process of wound healing. You might think, why should I care so much about skin? But it's way more than just looks.
It really is.
I mean, it's our first line of defense, right?
The body's frontline defense, yeah. Protecting us from all sorts of things.
Exactly. And when that defense is down, well...
It can impact the whole body.
Totally. So let's talk about the epidermis for a second.
Okay.
It's that outer layer, always working hard up there. But here's something that might surprise you. It doesn't have its own blood supply.
What?
Yeah. It relies on the layers underneath it for nourishment.
Wow, I didn't know that.
Yeah, it's pretty interesting.
That's a really important point for nurses to get, though, because it means even a small scratch, it can take longer to heal.
Right, because it doesn't have that direct blood supply rushing in with all the good stuff.
Yeah, the nutrients and repair cells.
Exactly. And that's especially important when we're thinking about patients with poor circulation or other health issues that affect blood flow.
Absolutely. And those tiny babies in the NICU, their epidermis is even thinner and more delicate.
Oh, for sure. It's no wonder they're so prone to skin tears.
Definitely.
So as nurses, we've really got to be on top of assessing and caring for our patient's skin,
Oh, 100%.
especially those who are at higher risk.
Absolutely. And we need to know those individual risk factors. For instance, did you know that as we age, the collagen in our skin breaks down?
Collagen, isn't that the stuff everyone's trying to keep for anti-aging?
Right.
What does it actually do for wound healing, though?
It's like the scaffolding of the skin, giving it that strength and, elasticity. But as we get older, we make less of it.
So the skin gets thinner and easier to injure.
Exactly.
That's why older adults are more likely to get pressure injuries and skin tears.
Right. And it's not just age. Lifestyle factors like sun exposure can really impact skin health, too.
Oh, totally. I'm all about that sunscreen. We need to be educating our patients about too much sun. But what about internal factors, though? How does a person's overall health play into this?
Well, the skin is like a window into what's going on inside. Things like dehydration, obesity, even some medications can affect skin integrity.
Okay, so dehydration would obviously make the skin dry and more likely to tear.
Right.
And with obesity, you have more friction and moisture in those skin folds, which is just asking for infection, really.
Exactly.
Like, we have to consider all these pieces to see the full picture of what's going on with our patient's skin.
Like a puzzle.
Yeah, totally. So we've got this amazing organ, incredibly vulnerable, too. And when that integrity is broken, we've got ourselves a wound.
Right. A disruption in the skin's structure and function.
And they can range from tiny scrapes
Yeah.
to major surgical incisions. But they all share something in common. The body wants to heal.
It does.
Like the body has its own built-in repair crew.
I like that analogy.
And that repair crew works in stages, right?
It does.
It's a carefully orchestrated process, kind of like a play.
I like that. A play, yeah.
Act 1 is hemostasis.
Where the bleeding stops.
Right. Blood vessels constrict. Platelets rush in to form that clot. It's like the body's first responders,
That's a great way to put it.
Then we move on to Act 2. The proliferation phase.
Rebuilding.
Yeah. And we get this incredible stuff called granulation tissue.
I love granulation tissue.
It's like the body's construction crew
Rare.
laying down that foundation of new blood vessels and collagen. It's pretty amazing.
Okay.
But it doesn't end there, right?
No.
We've got Act 3, the maturation phase.
Where the wound gets stronger.
And the scar starts to fade.
And becomes more flexible.
It's the finishing touches. Like the crew is polishing and refining their work.
That's a great way to think about it.
So as nurses, we have to be able to see these stages, understand what's happening at each step. It helps us catch potential problems and, tailor our care.
Absolutely. But it's not always smooth sailing, though.
Oh.
There are things that can get in the way of healing. Roadblocks we need to watch out for.
Okay, so we've got this intricate healing process, but there are these potential roadblocks lurking around. Let's dive into those next because that's where our nursing skills are really put to the test.
It's good to me. Yeah, it's like you need the right environment for a plant to thrive. Same with wound healing.
Oh, I like that. What are some of those garden pests that get in the way of healing? What should we be looking for?
Let's start with local factors. Things going on right there in the wound. One of the biggest is pressure. Imagine a wound that's constantly being pressed on, like on the heel of a patient who can't get out of bed.
Ouch. Yeah, that would restrict blood flow, wouldn't it?
It would. Make it hard for those healing cells to reach the area.
Definitely. And then there's the moisture balance, right?
Right.
Not too dry, not too wet.
Exactly.
Too dry and you get desiccation.
Like a plant wilting.
Exactly. But too wet and you have maceration. The skin around the wound breaks down.
That's right. It's all about finding that sweet spot. Moist enough to help those cells grow and move around, but not so moist that it weakens the surrounding skin.
And creates the perfect environment for infection.
Oh, yeah. We want to avoid infection at all costs.
For sure.
Infection can really throw a wrench in the healing process, prolongs the inflammation, delays healing, and can even lead to more serious problems down the line.
Especially for patients with weakened immune systems.
Exactly.
Okay, so we've got pressure, moisture imbalances, and infection, all causing trouble at the local level. But what about things happening throughout the body that can affect healing? Those systemic factors.
Well, age is a big one. Like we talked about earlier, infants and older adults have more delicate skin. But healing in general tends to slow down as we age, too.
Right, it's like everything else.
Pretty much.
And then there's nutrition.
Huge factor. You can't build a house without the right materials.
So true. Protein, vitamin C, zinc, all those things are essential for wound healing.
You need the building blocks.
And those building blocks need a way to get to the wound. That's where circulation comes in.
Right. If the blood flow is poor, well, those nutrients and oxygen can't get there, and the waste products can't be removed efficiently.
Check a traffic jam on the healing highway.
I like that.
And certain conditions, like diabetes or peripheral vascular disease, they can really mess with blood flow.
They can.
Make healing so much harder.
Absolutely.
So we've got all these roadblocks, local and systemic. How do we keep track of everything and make sure we're doing everything we can to help our patients heal?
Assessment is key.
Okay.
You're like a detective, looking for clues to explain why a wound isn't healing the way it should. You're thinking about the patient's age, medical history, nutritional status, lifestyle. You're checking out the wound itself. Size, depth, location, drainage, feeling for warmth, tenderness, looking for any signs of infection.
So many things to consider.
You've got to connect the dots.
Speaking of things to be on the lookout for, let's talk pressure injuries.
Big one.
Huge concern in healthcare. And the good news is they're often preventable. But I have to admit, I get confused about the terms sometimes.
It can be tricky. We used to say pressure ulcer, but now it's pressure injury.
Okay.
It reflects the fact that damage can happen, even before you see an actual ulcer.
So the skin can look fine, but there might be damage underneath.
Yeah.
That's kind of scary.
It is, which is why early detection is so important. And to do that, we need to understand how pressure injuries develop. It's not just about pressure, actually. There's friction, shear, even the microclimate of the skin.
Let's break that down. Friction, I get, that's the rubbing.
Right.
But shear.
Imagine a patient lying in bed. Head of the bed is raised. The patient slides down a bit, but the skin over their sacrum stays put.
So the body moves, but the skin doesn't.
Exactly. That creates a pulling force, shear. It can damage the blood vessels and tissues under the skin, even if you don't see a break.
Ouch. And what about microclimate? Is that just temperature and humidity?
It is, but it plays a bigger role than you might think. Think about patients with incontinence. That constant moisture makes the skin weaker, much more vulnerable to break down, especially when you add pressure and shear into the mix.
That makes sense. So it's not just one thing. It's this combination of factors. And then you have the different stages of pressure injuries.
Yeah.
I know they help us classify the severity, but I have a hard time keeping them straight.
Think of it like a staircase. Each step is a deeper level of tissue damage. Stage 1 is the first step. You might not even see a break in the skin, but it won't blanch when you press on it.
What does that mean?
It means the blood flow is compromised.
So even if the skin looks okay, if it doesn't turn white when you press on it, that's a warning sign.
Exactly. The tissue is being compressed, not getting enough oxygen. Then you move to stage 2, you start to see some skin loss, maybe a shallow ulcer or a blister.
And stage 3 is when it gets deeper.
Right. Full thickness skin loss.
Yeah.
It goes down into the subcutaneous tissue.
That's when things get serious.
Yes.
And stage 4.
Stage 4 is the most severe, extensive tissue damage. You're talking muscle, bone, even tendons.
Wow.
It's a reminder of why preventing pressure injuries is so important.
Absolutely. So we've talked about the skin's anatomy, the stages of pressure injuries. It's clear that assessment is so important for catching those warning signs. before things get out of control. But what are we specifically looking for when we assess a wound?
Let's get into that next, and then we'll talk about all the cool interventions nurses can use to help wounds heal.
All right, so we know assessment is key, but let's talk about the action part, the interventions we use to help wounds heal.
Yeah, it's like we've got this whole toolkit, right? And knowing which tool to grab for each wound is so important.
So first things first, pressure injury prevention. Repositioning is crucial, right?
Oh, absolutely. We've got to make sure those patients aren't staying in the same position for too long. Regular repositioning helps take the pressure off those vulnerable spots.
Yeah, give those tissues a break, let the blood flow back in. And what about those supportive surfaces?
Those are game changers.
Like the special mattresses and cushions?
They distribute pressure more evenly, help prevent those injuries from developing in the first place.
It's like giving them that extra layer of protection.
Exactly.
And we can't forget about basic skincare.
Oh, so important.
Keeping the skin clean and dry, especially for patients who are incontinent.
Absolutely.
We want to minimize moisture and friction as much as possible.
Oh, sure.
And those barrier creams can be a lifesaver. Really help protect the skin.
Especially in those situations, yeah.
Okay, so we're protecting the skin. But what about when we've already got a wound? Dressings.
Oh, dressings. There are so many.
I remember being so overwhelmed by all the different types when I first started nursing school.
I know, it's a lot.
It's like a whole other language.
Right.
But each dressing has a purpose, right?
It does.
Like those transparent dressings, the clear films. Great for wounds that don't have a lot of drainage.
Yeah, you can see the wound without taking the dressing off. Monitor for any changes.
Exactly. And for wounds that have more drainage, what do we use?
You could use a hydrocolloid dressing.
Those are pretty cool.
They absorb drainage, keep the wound moist, and they can stay on for a while.
Several days, yeah.
Like a little self-contained healing bubble.
I like that. What about for wounds that are really draining a lot?
Alginate dressings?
The seaweed ones.
Yep, they can soak up a ton of fluid.
Like little sponges.
They're great for heavily draining wounds. And they can help with debridement, too.
Debridement, getting rid of all that dead tissue.
Yeah, you need to clear out the debris so new tissue can grow.
Like making way for new construction.
Exactly.
Okay, so we've covered dressings. What about bandages and binders?
Bandages and binders provide support and help hold those dressings in place. They can help control swelling and improve blood flow, too.
And those wrapping techniques are important.
Oh, yeah, you don't want to wrap too tight. You could cut off circulation.
Right, for sure. And sometimes wounds need a little extra help with drainage.
Drains.
Those little tubes.
Yep, they help remove fluid from the wound, prevent it from building up, which can slow down healing and increase the risk of infection.
So important to keep an eye on those drains, make sure everything is working right.
Absolutely.
This has been a great overview of wound care interventions, but I know there's always more to learn. What about those new treatments that are out there?
There's some really cool stuff coming out.
Like what?
Negative pressure wound therapy, or NPWT.
What's that?
It uses suction to help wounds heal.
So like a little vacuum for the wound.
Basically.
That's wild.
It's been shown to speed up healing in some cases.
Very cool.
Yeah.
I've also heard about growth factors and stem cell therapy being used.
It's a really exciting time to be in nursing.
For sure. So much innovation.
Lots of research and development happening.
So we've covered a lot in this deep dive. The skin, wound healing, all those roadblocks, and a ton of interventions. What's the biggest takeaway for our listeners?
I think the main thing to remember is that skin integrity and wound care are essential parts of nursing. No matter what area you end up working in, you're going to use this knowledge every single day.
It's about looking at the whole patient, understanding their individual risks, and really advocating for their healing.
And never stop learning. Things are always changing in this field.
So true.
Be curious, ask questions, and keep learning new things.
I love that. Nursing is a lifelong journey of learning, so keep those brains engaged, those hearts compassionate, and those nursing skills sharp. We'll see you on our next deep dive.